A patient is bleeding from his descending colon. A procedure is planned through the femoral artery to stop the bleeding. During the procedure, the arterial catheter is most likely to proceed in which of the following orders? Now let's draw this out. The patient is bleeding from his descending colon. Remember that the descending colon is going to be part of the hindgut, and the hindgut is going to be supplied by the inferior mesenteric artery. So the catheter that was inserted is ultimately going to try to go into the inferior mesenteric artery. Now here's going to be the abdominal aorta. The abdominal aorta is going to give off a branch to the inferior mesenteric artery. Let's say that this is the inferior mesenteric artery. Now at the level of the pelvis, the abdominal aorta is going to branch off into the left and the right common iliac artery. Let's just focus on one side. So let's say that this is the left common iliac artery. I'm just abbreviating to make this clip shorter. So the left common iliac artery is then going to branch off into the internal iliac artery and the external iliac artery. So the pink is the external iliac artery and the purple is the internal iliac artery. Now the external iliac artery is going to become the femoral artery when when it goes below the inguinal ligament. So when the external iliac artery is below the inguinal ligament, it is going to become the femoral artery. Now the catheter was inserted through the femoral artery. So here we've inserted the catheter, and the first site that the catheter is going to reach is going to be the external iliac, and then it is going to go up into the common iliac, and then it is going to go up to the abdominal aorta, and then it is ultimately going to reach the inferior mesenteric artery, where we're trying to get to, because remember the inferior mesenteric artery is going to be supplying the hindgut, and the descending colon is going to be part of the hindgut. So the answer choice is going to be B. Now remember that the foregut is going to be supplied by the celiac trunk. The foregut is going to be from the distal esophagus down to the proximal half of the second part of the duodenum, so around this region. And the midgut is going to be supplied by the superior mesenteric artery. And the midgut is from the distal half of the second part of the duodenum down to the proximal two-thirds of the transverse colon, so around here. And the hindgut is going to be supplied by the inferior mesenteric artery. And the hindgut is going to be from the distal one-thirds of the transverse colon all the way to the rectum. And the patient was bleeding somewhere in the descending colon. And so the catheter that was inserted is trying to get into the inferior mesenteric artery.